Thyroid treatment success secret number 6, the dangers of iodine. The problem with iodine is if you walk into a health food store and you tell the manager, who usually has no medical background, they have no idea of what tests need to be run, I have a thyroid condition, how can I help myself? They'll probably give you iodine, which is one of the worst things you can do. According to one of the foremost leading thyroid experts and author of the book, Why Do I Still Have My Thyroid Symptoms Even When My Lab Tests Are Normal, Dr. Karazian, taking iodine is like throwing gasoline on a fire. Iodine is a red-hot supplement these days, and as I've mentioned, if you walk into any health food store and tell the manager that you have a thyroid condition, first thing they're going to reach for is an iodine supplement. This is the worst thing that you can do, so don't do it. Check your multivitamin. Does it contain iodine? If so, do not take it. It could make you worse. Granted, iodine is vital to thyroid function. It's a major cofactor and stimulator for that enzyme TPO. But for a person with Hashimoto's thyroiditis, for a person with autoimmune thyroid, for a person where their immune system is attacking the thyroid, supplementing with iodine is literally throwing gasoline on a fire. Iodine stimulates production of TPO. This in turn increases the level of TPO antibodies dramatically, which is indicating an autoimmune flare-up. Some people develop symptoms of overactive thyroid while others have no symptoms despite the test and elevated levels of TPO antibodies. This is why you need to run the test. I always advise anyone with an autoimmune thyroid or Hashimoto's thyroiditis to avoid supplements containing iodine, and this also includes multivitamins. You'd be amazed at how many people walk into my door with severe thyroid conditions and they're taking a multivitamin, they're taking all these other supplements, thinking they're helping themselves, and they're actually hurting themselves because they're making their condition worse. They're overstimulating or exceeding metabolic capacity of their immune system, and it's causing a massive fire that attacks their thyroid. Now, I know this seems confusing, but the reality is most health food store managers have no idea of the testing that needs to be done to get a thorough workup completed on a Hashimoto's thyroid patient. There are exceptions, and we have some good ones in our town. I'm going to be addressing those tests in future secrets, but trust me, you need a thorough workup, and most patients who are suffering with chronic thyroid problems, who are taking medications, still have symptoms, even though their lab tests are quote unquote normal. They need a thorough workup. They need the test done. Don't suffer another minute. Call our office at 336-229-4226 and schedule 2 free visits with Dr. Naylor. Call now. Space is limited.